77 WABC.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
1991, my father, who you know I adored, we just lost him a year and a half ago, we brought him to Dr. Lederman. You need to bring yourself or someone you know who needs to have the barnacles scraped off their backside to get their rear in gear and walk in there right now because Dr. Gil Lederman is New York's only triple board certified Harvard-trained radiation oncologist, first brought the non-invasive stereotactic body radiosurgery to America, and he's got the longest experience treating cancer using radiosurgery. So look, do yourself a favor. If it's cancer-related, and I'm talking breast, lung, pancreas, liver, kidney cancers, and more, you got to bring it to Dr. Gil Lederman. He'll send you an informative booklet DVD. You watch it first, you read, you sit down one-on-one with Dr. Lederman, and then you prepare for what it is you want to do and you should be doing. Just call Dr. Gil Lederman at 212-CHOICES. Set up that appointment today, 212-CHOICES, or set it up for someone you know won't do it for themselves. At 212-CHOICES, that's 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. I hope you're fine. And it's getting darker early, so it used to be a little light, and now it's dark. It's a holiday weekend. We're going to talk about a lot of things that happened to us. We are live, so if you have questions, you are welcome to call us. We have Bruce, who's running the controls, who's fantastic here at WABC. Our number, if you wish to call, is 1-800-848-9222. 800-848-9222. If you have questions or concerns or comments, please give us a call. So my name is Dr. Lederman. I am a triple board certified doctor. What does that mean? Well, it means I started school like most all of you at age 5. And then by age 25, I graduated medical school, and then I trained in internal medicine for 3 years at the University of Chicago and Michael Reese. Internal medicine is a study in diseases of the lungs, hearts, kidneys, intestines, brain, endocrine system. So that was 3 years and board certified in internal medicine. Then I went on to Harvard, and I trained in medical oncology at the Dana-Farber Cancer Institute for 3 years and gave chemo and took care of cancer patients exclusively there. And then I understood that a lot of doctors, they may be great in their field, but they don't know much about the other field. So let's just say it's a great gynecologist, but he may know nothing about urology. Well, sometimes those fields overlap. And for cancer patients often need or should be advised about the different modalities. So I said to myself, wow, if the chemo people don't know anything about radiation and the radiation people don't know anything about chemo, what happens to the poor patients who get stuck in the middle? There's a gap. and that gap isn't good. And actually, in some countries, when you're an oncologist, the oncologists are trained in both areas. It does not happen in the United States, but in certain countries, as an oncologist, a cancer doctor, one's trained in both. And to me, it was logical. Now, each training program was 3 years. So this is after medical school, which is 4 years, and after college, which is usually 4 years. I went to college in 3 years because my father thought if you do it in 3 years, you get a 25% discount, and you get out a year early, and it's true. And my son also went to college for 3 years and went to medical school. And you can do that. You don't have to spend all those years. And what you learn in college probably doesn't help you very much being a doctor. So that's how I ended up at age 35 with the first time I got out of training, because I had 9 years of training before starting work. But I am triple board certified in internal medicine, medical oncology, and radiation, and I believe it helps me take care of patients. And sometimes I wonder how people can take care of patients when they're only trained in one area. So for the patient, I think they get an added benefit. For me, I got extra years of studying, and I had great times. I enjoyed studying. Some people love to study, and some people don't love to study. I have a brother who didn't much love to study, but he's a doctor and did great and took care of his patients, and is very diligent. So there's different ways to get to hopefully the same point. Anyway, we're going to be talking a lot about cancer and cancer patients and news today. And say if you have questions, please feel free to call us. Radiosurgery New York is a freestanding cancer treatment center in the heart of New York City. So it's at 38th and Broadway, 38th Street and Broadway, right in the heart of New York. It's very close to Macy's and Times Square, and we're very close to Penn Station and Grand Central Station and Port Authority and all the trains and subways and buses that come to Times Square and Herald Square. And obviously we have a lot of people who drive in. Sometimes patients can't come in by train or bus or subway, so there's that aspect also. But we are super convenient. And private cancer center means we take care of you. We're working for you, not the drug companies, so we don't get money from pharmaceutical companies to put together protocols to push on people. No, because we think that's an undue influence. Now, there's other hospitals that do clinical protocols, but you should understand what a clinical protocol is. A clinical protocol often means that it hasn't been used in human beings before. There's no data. And we're a place that is very data-driven, so we don't like to do things unless there's data showing benefit. And that's to protect you. So if you want to give your body to science, you can do that. And some people literally give their body to science. When they die, they have a provision that they give their body to anatomy labs, and then the medical students actually, part of medical school is cutting up, dissecting a human cadaver, a human body, and those bodies are all given to science by their owners. So some people literally give their bodies to science, and some people give their functioning body to science by doing a clinical protocol, by taking treatment that hasn't been proven. So those clinical protocols are to determine whether the treatment would even be dangerous or not to a human being. And those are most of the protocols. And then there's some to see if the cancer treatment, if the new cancer treatment is functional. But usually it means that there's very little data. So for some reason people think, it's great to be on a clinical protocol. I think it'd be great to have the best possible treatment first. And obviously if you want to give your body to science, that's your own choice. That's a personal choice. All these things are personal choices. But it just should be clear what you're doing. So if you want to give your body to science, that's one thing, and it's perfectly fine. If you want to get the best possible treatment, call us, because that's what we do. We believe we give the best possible treatment. And, for example, brain and body radiosurgery allow us to treat the cancer with high degrees of success, usually around 90% where we attack. Body radiosurgery is a misnomer. There's no cutting, no bleeding. People walk in, get a treatment. All our treatments are on our site, 38th and Broadway. So you come in, get a treatment, and go home. And the beauty is most people tolerate it very well. I had a man who we treated for a brain tumor last week, and he said there were no symptoms. He said, you might as well walk around my head with a flashlight. And that's true. Most people don't feel a thing. So we treated his brain tumor. He had an acoustic neuroma, and we actually have the largest experience in the world treating acoustic neuromas with fractionated stereotactic radiosurgery. Fractionated means we divide up the dose. Stereotactic means we have an outside frame, and radiosurgery means a few intense treatments to hit the tumor but not hurt healthy tissues. So this man wanted to go on a Disney cruise, and he wanted to be done with his treatment, and he wanted to have his 5 treatments for acoustic neuroma. He didn't want anyone cutting open his head. He didn't want the complications. He knew that for surgery, open surgery of acoustic neuromas, most people end up deaf, and many people have damage to the face and are never the same again. He did not want to have Gamma knife because he didn't want to have the screws in the head, and he didn't want to have a single treatment that's more likely to hurt the nerve. No, doctors have known for many years that if we divide up the dose, divide up the dose into a few fractions, we can minimize most of the harm. And in fact, we gave up Gamma knife style treatment in 1993, more than 2 decades ago, because it was obvious that fractionated stereotactic radiosurgery is safer, less side effects, comfortable for the patient, better tolerated, better outcome. So I know lots of people still screw on the head frames, and we wonder what their motivation is. We like to provide treatment that's non-invasive, comfortable, successful, and I believe that's what we do for the vast majority of our patients. So if you have a question about brain tumors, benign or malignant, and we treat many, many benign tumors like pituitary tumors, acoustic neuromas, meningiomas, you can give us a call, or we'll send you a booklet. If you have cancers of the brain, and we're going to be talking about them in just a few minutes, like metastasis to the brain or glioblastomas, astrocytomas, give us a call too. We're very familiar. We were the first in New York with brain radiosurgery. There's a reason for that. I think the reason is that we understood that if you can hit the cancer and not hurt the healthy brain, you're a lot better off. So that's what we do, and that's a technique that we brought to New York more than 2 decades ago. So we're proud of that, and we're proud of the foresight and vision and boldness that we had to bring non-invasive brain radiosurgery to New York years before all the other facilities. Yeah, and that means we have more experience than the other facilities over more years. It's a very simple matter. And we were the first to bring body radiosurgery to New York, to America, to the United States, to the Western Hemisphere, to North America. We were the first in the Western Hemisphere to perform stereotactic fractionated body radiosurgery in the Western Hemisphere. So if you have a question, feel free to call us. For a medical condition, it's really best that we sit down in person and discuss everything together. So there's usually lots of issues, and usually I discover things that even the patient and their loved ones didn't know, didn't realize. And so that's why time together matters so much. And we don't cheat people with time. A lot of my patients say, wow, you're so different than all the other doctors. Well, we try to be different and better. We try to give you enough time and understanding and answers so you feel comfortable about your condition, about the consultation, and that there's a different level of care, a better level of care available for you at Radiosurgery New York at 1384 Broadway in New York City, the heart of New York City. So we're going to stop for just a moment after all those explanations, and we're going to hear from a few new voices, and then we'll be back to talk about cases and news and answer